Hi there, my name's Carolyn Wiskin. I'm a clinical pharmacist at Charlton Health. It's my pleasure to share a series of little vignettes that go over all the aspects of biosimilars. Many of you have been on a biologic medication for years and have heard this term biosimilar and want to know more about it and how it impacts you. So stay tuned as we explore this together. What is a biosimilar? Well, to understand that, we really have to know what a biologic is, because biosimilars are biologic medications. And they're very complex medications made from protein that are generated by programming living cells to make these proteins. It really is a bioengineering feat. But we're so happy to have them because they've revolutionized the way we treat so many medical conditions, from types of cancers to diabetes, and certainly our autoimmune conditions where excess inflammation is made in the body. I'm often asked, what is the difference between a biosimilar and a generic medication? Well, they certainly are different. Just think about Tylenol. Well, Tylenol, its patent expired, and many other companies were allowed to make acetaminophen under their own brands. Now, a generic takes a few years to have that research done, and it just has to be shown that in a lab setting that the structure and the way it dissolves, everything is identical in a system that mimics what would be in a human body. But we don't have to do studies to show it's as effective. We're just comparing it in the lab. Now, let's take the example of the biosimilar. Well, biosimilars are made from protein, so they're much more difficult to reproduce, because another company coming in, once the patent has run out, uses their own cell line to produce these proteins. So what has to happen is that we have to study the biosimilar in patients with a condition that was originally approved when the originator came on the market to show it is as safe and as effective. Well, that process can take 7 to 9 years to come on the market. And we're looking at $100 million versus a couple of million in terms of the expense to make that happen. So we have great confidence when a biosimilar is approved by Health Canada that robust research has happened to ensure that these products are not identical, because even batch to batch of the originator, there can be variations in how proteins are produced. So we have to refer to these as a biosimilar. So the question is, why switch? You're on a biologic, it's working well. Why would you move to the biosimilar just because the patent has expired from that original product? Well, truly, it's cost savings. It's not a medical reason. And why would there be cost savings? Well, when the biosimilar comes on the market, a lot of research went into the development of that original biologic medication. And the biosimilar now has to produce something to be as close as possible, and yes, do robust research, but they don't have to come up with the initial protein. And as a result of that, they can do it at a slightly lower cost. But that cost savings over all the people that require these medications is significant and allows those funds to be used for the development of other treatments and to support many patients with all the developing new therapies that we have. And so we call it a non-medical switch, because we feel that it is offering patients still equal quality and effectiveness at a cost savings to the overall system. I get the question, is it safe for me to move from my original biologic to a biosimilar? And of course, in all the research that has been done, safety is paramount. We want to ensure that there aren't any differences in adverse effects. And we want to know that if over time the medication is used, such as a protein-based medication, a biologic, that there isn't a difference in the body recognizing that protein as foreign. Now, some of you may have not have heard of this term, but there's a big word called immunogenicity. And what that actually means is that when we give a biologic, a protein-based treatment, that over time, some people may recognize it as a foreign protein. You can start making an antibody against that medication and begin removing it so it's less effective. So one of the things when we look at safety is we also want to ensure that we are not developing antibodies against a biosimilar at a greater rate, that the body's not recognizing a biosimilar as a foreign protein at a different rate than it would the originator. And so all our studies of biosimilars have shown that there is no issue, that these medications are definitely as safe, there is not greater side effects seen, and that we do not see the loss of effectiveness happen at any different rate, that the body's not recognizing the biosimilar any differently in terms of making antibodies against it as it would the originator product. One interesting piece is that with some of our biosimilars that have come on the market with different designs, different auto-injector units, some of them have come out with lower, more concentrated volumes. Some of them have come out with different additives, without citrate as an example. And so truly, when we think about a site reaction or pain even as a safety or side effect, you know what? We're sometimes seeing with a biosimilar, it may be less than the originator. So that's really interesting to note as well. So the question, is it as effective, a biosimilar versus the originator biologic? And truly it is, and that's why it is approved by Health Canada. In fact, in many trials, there is a switch that happens where patients are on the originator product, move to a biosimilar, move back to the originator, and in some trials have done this more than once and shown that the efficacy remained the same. So we've had great confidence that studies that have been done around the world, and also not just around the world, but yet in Canada, where switch has happened a couple of years ago, that not just in the studies that were done, but that in real life experience where these switches that have occurred, that the product remained as effective and as safe. And so now when it comes to the province of Ontario launching into biosimilar switch, we have so much to go on with many robust trials and much life experience around the world and here at home that gives us great confidence as we move into this switch time. Financial support has been so important with our biologic medications because they are significantly expensive. And so with biosimilars coming on the market, I know many of you have wondered about the support programs that you've been used to with the originator biologic product. So I want you to rest at ease that every biosimilar has a support program to offer financial assistance, complementary doses where needed when there perhaps is an insurance change, and you will expect the same level of coverage and financial support that you have known with the originator product. Now, of course, there will be a different company and perhaps a different person that you're working with as your support worker. And yes, that's a different person to get used to, for sure. But you can have the confidence that they will navigate and support you in the same ways that you have always been used to. As you can see, there are many biosimilars. What we have shown on this table are just the biosimilars for the product adalimumab, the originator known as Humira. 8 different companies approved by Health Canada with their biosimilars, each of them receiving their own now patent on devices specific to their company. So it's really important for people to understand that there can be differences between these devices. You may find one feels better in your hand. It's easier to see the viewing window, some being citrate-free, latex-free, or a higher concentration, all things that can actually impact injection comfort. So we're going to move now to looking at how some of these work. Here we have all the biosimilars for adalimumab. The originator product, Humira, was developed 20 years ago. 2 caps, one that went over the end where the needle comes out, and the other covering the trigger button. Well, with our newer devices made by our biosimilar companies, no longer do we have the 2 caps, and we generally have much bigger viewing windows. There is 2 main styles, ones that do not require a trigger button at all. I'll give a couple of examples of those. Hadlima does not require a trigger button, as does Julio, as does Simlandi, as well as Hiramos. Let's just take one as an example. I pull off the outer cap, and then I'm going to push it against the skin, and the sheer push activates the device. You hear a click when it starts, and there will be a second click when it ends to indicate the injection is done. There we are. If I take one requiring a trigger button, that would be a medication such as Abrelata. We also have Idacio that requires a trigger button and Amgevita. So here I am. I'll remove the outer cap and then take the medication. We see the large viewing window. We push it against the skin and then push the button. The second click indicates it has finished. So for many of our devices, as mentioned, it really is about preference of how it feels in hand and keeping in mind that some of these devices are citrate-free, latex-free, and may have a higher concentration, meaning a lower volume injection that can improve comfort. Another biologic that has biosimilars on the market is etanercept. Etanercept's originator is known as Enbrel. Enbrel has a cap that goes over the end where the needle comes out and a trigger button. You must depress it against the skin and then push the button to activate the device. And this is what you would know if you have been on Enbrel in the past. A sound is heard when the injection is complete. The two biosimilars we have available to us do not require a trigger button. So first I'll show you Brenzys. We remove the cap at the end, large viewing window, again push down on the skin to activate. We must keep that pressure solid against the skin as the injection completes. And there's the audible sound to indicate it is finished. Our second one is Erelzi. Also does not require a trigger button. We press it against the skin to activate. You see the trigger button come down, and there is an audible click at the end to indicate it is finished. Some of the differences between biosimilars I already mentioned, such as latex-free, citrate-free, but another one is room temperature stability. Some of them are good for an extended period at room temperature, and others have less time. So these are all things that you may want to assess when looking at biosimilar options. Beyond the auto-injectors that I've shown, there are medications that are biologics that are given in infusion clinics by IV. Infliximab, the originator being Remicade, is one of those, where there are several biosimilars, all Health Canada approved for equal efficacy and safety. The other being rituximab, the brand name Rituxan, where there are also several biosimilars available. I think the most important message out of this biosimilar video is recognizing that many of our health professional organizations and patient groups have acknowledged that there is importance from this pharmacoeconomic aspect of switch, and that we have to embrace this as switch occurs across this country. But what is always mentioned as a vital part of that is that patients are part of that journey and are understanding and working with their health professionals to achieve a switch that is successful for them. Thank you so much for joining me for this series of vignettes to understand biosimilars. My name is Carolyn Wiskin, and I am proud to be a clinical pharmacist working in this area.